The signs of skin cancer will vary depending on the type of skin cancer. There are different types of skin cancer, the most common being basal cell carcinoma, and this can present in different forms, even as a scaly patch, sometimes mimicking eczema, through to a red spot, which may bleed, or even a waxy yellowish scar-like plaque, known as a morphic basal cell carcinoma. Then there is squamous cell carcinoma, which is the next most common, and this can appear as a hard lump, a scaly spot, or a horn-like appearance. And finally, melanoma, which most people are familiar with as a mole, which is dark, getting bigger. But occasionally, melanoma may not have much pigment and can present as an amelanotic melanoma, which is just pink. So it can be difficult and confusing. And these aren't the only types of skin cancer. I've just mentioned the three most common. This is one of the most important questions, and also one of the most difficult to answer, because it is confusing to know exactly what to watch out for, as changes can be subjective. In general, looking out for a new lesion which you weren't aware of before, and monitoring that to see how it's changing, or an existing lesion that may be changing in size, shape, or color, would be general principles as to when you should seek further attention. But in simple terms, if someone has any worries, they should see a doctor just to be on the safe side. So with the three main types of skin cancer, that is basal cell carcinoma, squamous cell carcinoma, and melanoma, within each of those types, there will be different degrees of aggressiveness or severity. Overall, a melanoma will have the greatest potential of the three to metastasize, that is, spread around other parts of the body and then be deadly. But it will depend on the type of melanoma, how thick it is, for example, and other features. So in general, basal cell carcinoma is the least aggressive, melanoma is the most aggressive, but there'll be variation within each category depending on the specific case. The treatment of skin cancer will depend on the specific type of skin cancer, but in general, and fortunately, skin cancer can be cured just with surgery, i.e. cutting out the skin cancer. With basal cell carcinoma, the more superficial or less aggressive type can sometimes be treated with a cream or photodynamic therapy, where a cream is applied and then a light is shone on the skin to create a chemical reaction which selectively destroys the basal cell carcinoma cells. And then for more aggressive basal cell carcinomas in high risk sites where we're trying to preserve tissue on the face, Mohs micrographic surgery can be excellent. Radiotherapy and drug treatments can also be used, in particular where surgery is not appropriate, and for the more advanced type of melanoma where it has metastasized, drug treatments will be more used. There are many ways somebody can protect themselves from the sun, ranging from wearing a hat, appropriate clothing, and staying in the shade. Sunscreens are, of course, a very important component as well, and it is really important to apply the sunscreen regularly throughout the day and not assume that applying once in the morning will provide adequate protection throughout the day. This will be most important for those skin types which are fair and burn easily in the sun. So using a range of different methods would be the best way to summarize this.